Good day, Doctor and everyone. My name is Tekwiti and we are from Group 8. In this video, we will like to present our report with the effectiveness of government spending on improving Malaysia life expectancy from 2012 to 2017. Staying health and well-being definitely considered as human right. Good in health management system has strong connection with life expectancy. In Malaysia, government plays a vital role in offering good health system for citizens through public health clinics and hospitals. I found that the public expenditure on health service reached around 3.76% of GDP in 2008, with the greater part from public spending. In this report, we are going to analyze how the effectiveness of government spending on improving Malaysia life expectancy.
So now we move on to the objective of the study. The first one is to study the effectiveness of a government expenditure in Malaysia from 2012 to 2017. The second one is to analyze the factor that influence the trend of life expectancy at birth in Malaysia from 2012 to 2017. And the last one is to observe the trend of life expectancy at birth based on the government expenditure in Malaysia.
I would like to start the analysis of the MOH expenditure and the Malaysians' life expectancy at birth in year 2012 to 2013. In 2012, MOH expenditure amounted up to 18,239 million ringgit. In year 2013, 19,380 million ringgit. There is a 6.25% increase compared to 2012. And we look at the Malaysians' life expectancy at birth. There's also an increase as well. In 2012, 74.88 years, and 2013, 75.07 years. So there's an increase of 0.195 years. I want to add that in 2012, MOH has provided financial aid and subsidies to NGOs, such as the assistance for health-related activities, capital grant to new dialysis centers run by NGO, and the last one is the hemodialysis subsidy. In overall, MOH efforts on the high allocation and the high spending in 2012 to 2013 has paid off, as we can see in Malaysians' life expectancy of 2012 and 2013 has increased.
Malaysian National Health Account present the amount 21,000 million of total expenditure on health, which increased compared with 19,000 million in 2013. For the increasing part from 2013 to 2014, we can look at the source of financing. Second, financing to providers, and the last is function of healthcare. First, source of financing. Health expenditure in public sector total increase. For example, Ministry of Health reached the highest spending from 19,000 million to 21,000 million. Second, financing to providers. Financing to provider has been contributed 25,000 million in health expenditure. As we can see, all hospital is the provider healthcare, which is spending the highest in expenditure with 15,000 millions. And last is about the function of healthcare. It consumed 25,000 million in 2014. So, in the conclusion from 2013 to 2014, it is efficiency on the increasing health expenditure, and it can be proved by life expectancy, which increased from 75.07% to 75.27% in 2014.
From 2014 to 2015, MOH expenditure has increased to 22.6 thousand million ringgit. At the same time, life expectancy value also increased to 75.461 years. By looking into details, all hospitals has recorded higher spending as provider of healthcare, which is 16.4 thousand million ringgit in 2015. Based on the function of healthcare, the service of curative care and the preventive care has dominated as the top expenditures, as the government aimed to increase the capabilities of healthcare providers to cure any medical issue, as well as raise awareness in preventing any medical issues.
Okay, in 2016, the public sector health expenditure of Malaysia was allocated 52% of their total expenditure on health, which equals to 26,662 million ringgit Malaysia. In 2016, the expenditure was focused more on service of curative care by allocating the highest fund by about 68.57%, and there were several other services, but this was the highly funded because it requires more money in order to treat patients, no matter inpatient or outpatient, on a daily basis, so that they could offer medical help for the needy ones without actually thinking about their financial requirement and everything like that. So these are few services that were funded. For example, health program administration and health insurance, and public health service, education and training of health personnel, capital formation of healthcare provider, institution, medical goods dispensed to outpatient, and other expenditures. So in a nutshell, the life expectancy of Malaysian has grown by 0.25% in 2016. So the number of 2015 was 75.461 years old, and it increased to 75.649 years old. So there are slight increment. Maybe it's not huge, but it's better than 2015. So this shows that with better health expenditure, the life expectancy at birth of Malaysian improves. So the higher the health expenditure, the higher the life expectancy of Malaysian. This is the analysis for 2015 and 2016. For the year of 2016 to 2017, Ministry of Health spent 22,225 million ringgit in 2017 to 24,716 million ringgit in 2017, which we can see the increasing rate from 2016 to 2017. In terms of health expenditure by functions, it was including expenditure for core functions of healthcare. The total expenditure by functions of healthcare in 2017 was 19,363 million ringgit, which deliberately increased from 17,798 million ringgit in 2017. As you can see on the screen are top 3 of the expenditure by function in 2017. The first one is outpatient care services, where we can see the government spent 8,034 million ringgit, while inpatient care services was 4,506 million ringgit. The next one is the expenditure in pharmaceutical, which is 2,922 million ringgit. And last but not least is the health and education and training, which is 1,400 million ringgit. There are many more functions that all of it showing the increasing values from the previous year, which is on 2017. As a result, Malaysian citizen life expectancy at birth had increased slightly more in 2017, which is at the age of 75.828 years from 75.649 years in 2016.
Based on previous studies, the result of our study supports the claims of Jabars et al. 2014, which there is significant impact between health expenditure and life expectancy, which contradicts to the findings of Hilver and Aurelio 2017, where social effect expenditure are major indicator, not health expenditure. There is one obvious point in our study where the expenditures decreased. However, life expectancy remained to grow from 2015 to 2016. This is due to the health expenditure on health promotion and prevention has significant increase on that years. It is because the government aims to improve Malaysian quality of life as it is able to prevent disease and promote healthy lifestyle. This also highlights that the health expenditures are able to make significant impact on life expectancy. As for the recommendation, the government should reduce or eliminate the access fee to Malaysians to access healthcare service. The government should also distribute the incentive to any company that promote and practice healthy lifestyle in their work.
Finally, we would like to conclude that the MOH expenditure has shown an overall increasing uptrend from year 2012 to 2017. By analyzing the MOH expenditure and the life expectancy of Malaysian, we can see that MOH has come to a realization that if they spend more budget on the public healthcare, Malaysia will have higher life expectancy. That is all from us. Thank you.